Hi, my name is Annika, and I'm one of the nurse practitioners here at Pediatrics West, and today I'm going to talk to you about one of my favorite adolescent health topics, and that is birth control. And I think when most people hear birth control, they just think about pregnancy prevention, but these are actually medications that we can use to treat a variety of different conditions that tend to happen with our adolescents more than anyone else. So I'm going to share some of those with you today, and then also go over very briefly the different methods that we can use to treat these conditions. One of the most common things that we hear from our teenagers is that their periods are irregular or heavy, they're really painful, they get nauseous, maybe they get headaches around their period, maybe they have acne that they want to deal with. All of these are things that we can treat with hormone-based methods of birth control and are a really common reason why our teens come in and talk to us about these options. I think the most commonly known method of birth control that's out there is probably the pill, and that is a really great method, but there are lots of others I want to talk about as well. The pill is in a class of medications that we consider combined hormonal contraceptives. We've got the pill that you take every single day. We have a patch that you change out once a week. We have a vaginal ring that you change out once a month. All of these contain both estrogen and progesterone. All of them are really good at giving us regular, light, short, pain-free periods. And it's really just a matter of how often do you want to remember to use your birth control. These methods, especially the pill, are also fairly good for addressing concerns over acne, and the pill can be really helpful with menstrual migraine treatment as well. There is a progesterone-only pill that we can use, although we don't use it very often because it does need to be taken at the same time every single day in order to work, and that can be really hard to do when you have a busy schedule. The next method of birth control that we think about is a progesterone-only method. It's called Depo-Provera, and it's a shot that you get in your arm every 3 months. You have to be okay with needles in order to get it, but it can be very effective at treating heavy menstrual bleeding as well as painful periods. And it's something you only have to remember once every 3 months instead of every day, week, or month, like with our combined options. And then the last category that we have are our long-acting contraceptives. These are also progesterone-only methods of birth control, and the most common one that we use in our office goes by the name of Nexplanon. It's an implant. It's a 4-centimeter kind of flexible rod, and it sits in the bottom part of our arm here. And once this is in, it's good for 3 years. It's a really simple procedure that we can do here in the office. We use some numbing medication like you would get at the dentist to make sure that you don't feel any discomfort when it's going in, and the insertion overall takes less than a minute. Once this is in, you've got birth control for 3 years, but it can also be used to treat heavy and painful periods as well, and it's very effective at doing that. The other long-acting method of birth control that we have is an intrauterine device, or an IUD. And this is not something that we're able to do in the office, but we would refer you to a very skilled adolescent gynecologist to get this put in. But it's a little soft, flexible T, and it just kind of gets inserted through our cervix and sits in our uterus like this. The hormone-based versions of this are good for 3 to 5 years, depending on the amount of hormone that's in them. And there is also a copper version that's just used for birth control that's good for 10 years. One thing I always like to mention when I'm giving this counseling to patients is that even if you choose a method that lasts for a long time, just because it's good for 3 years or 5 years doesn't mean that it has to stay in for 3 or 5 years. And if at any point after insertion you want it out, we just take it out. It's your body. We want to do what you want to do. So those are all the different methods of birth control that we have available. And like I said, we treat a variety of conditions with them. But pregnancy prevention is one of the big things that we're talking about when we're looking at birth control. And our needs from when we're 13 and we have heavy periods and acne might change to when we're 18 and we're going to be going off to college. And what's great about having a variety of methods is that as your needs for birth control and hormone treatment change, so too can your birth control change. And we want to make sure that we're having really just kind of good conversations with our teens about how to stay healthy. So one thing I always like to mention is that all of these methods of birth control are going to prevent pregnancy, but they won't prevent sexually transmitted infections. So whether you or your partner is on really good birth control and pregnancy prevention is a concern for you, you also need to think about STD prevention. And that's typically in the form of a condom or some kind of dental dam, a physical barrier between the skin. So we always promote high quality birth control plus some kind of physical barrier so that we're addressing both of those needs. And at Peds West, we recognize that these are very sensitive topics, and it can be difficult to have these conversations, teenagers with your parents or parents with your teens. So we're here to help navigate those conversations. All of our providers can talk to you about these things, and we have 4 providers that are specifically trained in all of these methods of birth control. So if it's something that you need to go on for whatever reason, come and talk to us. We're here for you.